Okay. Hello, everyone. Welcome to Mom's Corner. I hope everyone's doing well today. My name is Zainab, and I will be your host today. And I'm excited to be here with you. I want to thank everyone for joining us. Thank you for those of you who are regulars on Mom's Corner. Thank you for being here. And for those who are newcomers, welcome and thank you. Before we proceed, just a few housekeeping items. I want to remind everyone that, as promised, we will issue the stipend for everyone who's here today at the end of our session, and I will go ahead and drop that link at the end of our session, so stay tuned for that. And it is a participatory stipend, so we encourage everyone to participate any way that they're able. If you want to open your camera, send questions or comments via the chat box, or just use your emoji features to express yourself. Those are all fine. Please make sure to change your screen name to the one that we'll be sending the stipend to, so that we have the right person. And just a brief introduction of Mom's Corner. Mom's Corner is one of the many programs under the umbrella of Global Perinatal Services, or GPS. And GPS is a nonprofit organization doing amazing work and changing lives every day. Our mission is to provide community-based doula services that will educate, respect, and empower low-income Black, refugee, and immigrant women and their families during pregnancy, birth, and early parenting. And Mom's Corner is not just a space for moms, but for all women folk and supporters of women. At GPS, we believe that motherhood is an extension of a woman's identity and not the definition. And Mom's Corner, since the pandemic, has become not just a space where we come to find empathy, support, and camaraderie, but safe haven and access to so many critical resources in our communities. We will have a Q&A after the presentation, but if you have any questions or comments anytime during the presentation, please feel free to let us know. And just a great thank you again to our doctors for being here today, who will be talking about the neuroscience of and psychology of behavior in children and teens. And so without further ado, doctors, the floor is yours.
Awesome. Thank you so much. We are thrilled to be here. I'll just introduce myself briefly. I'm Dr. Kime McClintock, one of the residents at Swedish for Cell Family Medicine.
Hi, I'm Dr. Susie Greenman. I'm also one of the residents, and thank you so much for having us here. So,
just some brief disclaimers that we wanted to start with, that Susie and I are both family medicine doctors and resident doctors. We're not psychologists and not psychiatrists. And while we do work with children and adolescent patients regularly and deal with a lot of particularly mental health, I would say depression, anxiety, as well as some more complex mental health concerns in our clinical roles. It is just one of many things that we cover within the scope of family medicine. And then the other disclaimer that's a little bit more broad is just as we talk about behavior and neuropsychology of children and teens, I think it's also important to remember that the roles and responsibilities of children and teens is not only it's not just a medical and a scientific concept, that it's also really influenced by culture, time, and place, and that the experience of these life stages are sort of only partly explained by biology and sort of the science that we'll talk about today, but it's very complex.
yeah, so we'll start with an overview of child development and some ideas of the theories behind child development, and then talk a little bit more about childhood experiences, adverse childhood experiences, and how that affects kids. And then go into neuroscience before ending with a Q&A session. And we really want to make sure that we have time to answer your guys' questions. And, like Zainab said, that feel free to interrupt us at any time with questions. So when you guys think of children's behavior, what comes to mind and what are your big questions? And I can't see chat, so Kime, if you...
Yeah, if people put things in the chat, I'll try and read it as we go along. I know one thing that comes to my mind, first of all, is like children being very playful.
I'm at my sister's house right now, and she just had a baby a few days ago, and her 2.5-year-old, very, very argumentative and attention seeking.
And then we have someone in the chat has put in children's curiosity.
Mm.
So true. Thinking of tantrum, another good comment.
Mm-hmm. Good. Thank you for sharing. Yeah, so as children go through different stages of development, there's different stages of biological development and then also stages of psychosocial development. So one theory of development was created by Dr. Erik Erikson, and he basically broke it down into conflicts. So what is your main goal at different times in your life? And when you have this conflict, depending on how it's resolved, you either, walk out of this conflict with more trust in yourself or more problems throughout your lifetime. So, for example, the infant stage. So stage 1 in infancy is trust versus mistrust. So this is when an infant is learning about the world. And, the hope is that they are trusting in their parents and that their parents are able to help guide them as they navigate the world and learn about their bodies. They are learning to trust based on how well their caregivers meet their basic needs and respond when they cry. They're completely helpless. So if an infant cries out to be fed, the parent can either meet this need by feeding them and comforting the infant, or not meet this need by ignoring the infant. And when that need is met, infants learn that relying on others is safe. And when that need is not met, then infants grow up to be less trusting. So that's the first stage. The second stage is when we're talking about toddlerhood. So now kids are walking around and they're starting to learn about what they can do on their own versus what they need help to do. So this is autonomy and learning about autonomy versus shame and doubt. Another way to think about it is independence versus dependence. What can they do on their own versus what they need help with? So, if they are given an opportunity to learn how to go about and, sometimes make mistakes, but fall on their face and then get back up and keep trying things, then that will lead with them feeling like they have independence. If they go through this stage and they're responding to caregivers, and caregivers encourage them to be independent and explore the world on their own, they're going to grow up with this sense of self-efficacy. Whereas if caregivers are hovering and not giving them an opportunity to be independent and not giving them an opportunity to fail or succeed, whichever it is, then they grow up with less confidence in their abilities and less desire to go out on their own, without having first being given permission to do so. So for example, if a toddler wants to walk without assistance in a safe area, the caregiver should encourage this autonomy by allowing the independent behavior. If the caregiver insists on holding the toddler's hand, even when it's not necessary, that can maybe lead to doubt later in life, with the kid not thinking that they can do something. Then you get to preschool years, and this is when we're talking about initiative versus guilt. So this is when kids learn to speak up for themselves and assert themselves and learn about what their opinion is and how to express it in the world. So, if they're sad because a friend stole their toy and they say that, then they, if someone responds to it in a positive way, saying, yeah, I appreciate that you're sad, and that's a good response, then they'll learn that, this is a helpful behavior, or having sadness and speaking up about it is a helpful behavior. But if someone, gives them makes them feel guilty for speaking up, or makes them ashamed for speaking up about their sadness, then they might grow up to be timid and less likely to speak up. The next stage 4, is in the early school years, so elementary school. And this is when they start to, it's no longer about kids and their expression inside versus outside. Now it's about how you compare to your peers. So they start to compare themselves with their peers. And if they feel like they're accomplished in relation to their peers, then they'll start to develop self-esteem. However, if they feel like they don't measure up, then they start to struggle with that. So, for example, a first grader may notice that they are constantly doing worse on spelling tests when compared to their peers. And if it becomes a pattern, then they can develop these feelings of inferiority. So it's about how they measure up to people who are similar to them. And then in adolescence, this is when you start to identify who you are. So the adolescent stage is where the term identity crisis originated. Adolescence is all about figuring out who you are. You know, you are clearly different from your parents. You're figuring out what's important to you, what you want to do with your life. And people who can clearly identify that grow up with stronger goals and stronger self-knowledge than teenagers who struggle to break free, to figure out, who struggle to differentiate between what's important to them versus what's important to their parents or their friends. So this is about, you know, kids developing what will become the center of their personality and the center of their morals as they grow up. If at this point adolescents are still deeply dependent on their parents for social interaction and guidance, then they may have more role confusion, especially later on in life, than teenagers who have an opportunity to pursue their own interests. And then at this point, now we're reaching towards the end of teenagehood, where we are at young adulthood, where we start to, it's no longer about just me, but it's also about where I fit in the greater society. So it's about intimacy and starting to solidify your lifelong bonds. So the conflict here is whether or not you're able to create relationships with people, committed relationships, and form lifelong friendships. If you're able to create and maintain these relationships, then you reap emotional benefits, whereas people who are not able to then struggle with isolation for the rest of their lives. So those are the main stages, according to Erik Erikson, for children growing up. Any questions on this particular model?
Hey, Doctor, I was wondering about what do you call identity crisis later in life? Some people do experience that. Is that just like having gone through it once and not resolved it, but then it comes back and you have to work through it?
Yeah. So for Erikson, the way that he thought about your midlife crisis was, this was when you get to, so you have your middle age and then your older adult age. So when you enter your older adult age and you're looking back at your life and you're trying to evaluate whether or not you've created something that you're proud of, that identity crisis typically happens at that point when you're switching from middle age to older adult. And if you have something that you're proud of and something that you feel like is a good representation of who you are and what you will be leaving the earth with when you die is something that you are proud of, then those type of people tend to not go through a midlife crisis. Whereas if you're in your middle years and looking back and think about how you just wasted the last couple of years just working for the man and not doing something that's important to you, then you tend to have this crisis of, what am I doing for the rest of my life? Or feeling like your life has no meaning. Does that make sense? And answer your question?
Yes, thank you. Yep.
Yeah. So Erik Erikson is just one, he's just one psychologist and one theory. There are other theories that are more related to like neurodevelopment and biology. And this one is developed by Jean Piaget. So basically, Dr. Piaget broke it down into what you're developing at different points in your life. So from birth to 2 years, this is really where a child is learning how to interact with the world. You're learning about what your body can do. You're learning about feeling the world and experiencing the world and understanding what is around you and what is out there. So everything is very concrete. Whereas once you get to years 2 through 7, so toddler years, so this is pre-operational. So at this point, this is when kids start to think a little bit more abstractly. They have more symbolic thought. They can understand that other people have different opinions besides their own, and they're able to contemplate things like imaginary friends that are real versus not real, things like that. They become more curious. So this is all about them basically learning about the world from a more mental level and understanding more about what's happening besides just what they can see and what they touch. And once they hit 7 years, now we're in this concrete operational stage. And this is where they start to solidify their abstract thinking and start to be able to understand cause and effect. And they understand logic and understand the logical implications of their actions. So if I do this, then someone else, feels this. And not to say that kids younger than 7 don't understand this, but this is, according to Piaget, when most of this development happens. So this is when a kid starts to understand their role in the fact that, their actions have meaning, and that what they do is important, not just to them and to their life, but to the people around them, and understanding that everybody around them has their own experiences and wants and needs as well. And then teenagehood falls into this category called formal operational. And this is where these teenagers start to think for the future. And at this point, they can start to think much more complex ideas. So hypothetical ideas, a what if idea. They're able to assume new responsibilities. They understand consequences, and they establish their identity or sense of self, develop a stance on different moral and social issues. So these are just, again, two different types of theories about development. Any questions on this one? Okay. But as we all know, not everything is always beautiful and dandy. And there are a lot of things that happen in childhood that is not great. And the term that we use for this is adverse childhood experiences or adverse childhood events. And these are traumatic events or experiences that children suffer that have been shown to increase the risk of developing both physical and mental illness later in life. So the higher amount of ACEs that one has as a younger child, the more likely they are to have more chronic diseases as they get older. And a lot of people think that this has to do with what's called toxic stress. And basically, you start to create this stress response and are constantly living in a experience of high stress, high fear. And that can lead to lasting wear and tear on the body and the brain, and always having really high amounts of stressful hormones going on. Has anyone ever heard this term before? Adverse childhood experiences or events? And this is not to say that, if anybody has a horrible childhood experience, that they're definitely going to be ill and they're definitely going to have problems later on in life. That's not what the science shows. People can prevent and counteract lasting harm by helping children to go through and you can work through, these events that you had and teach them that it's, not their fault, or ways to cope with stress so that it doesn't build up and create these disease states later on. So these can be a lot of different things. So, and it's important to note that people from all income levels, all social identities, all of this can happen to anyone. Sometimes it's something, completely out of everyone's control, like an earthquake and losing your home. But all of these can have serious health and mental side effects as well. Any questions on this?
Looks like Taylor in the chat had said that was their main question that you brought up, just, how can we sort of negate the impact long-term of ACEs? And yeah, so Taylor's saying, so parents can recover from childhood ACEs.
Absolutely. And there's a lot of research that's being done into the effect. I think that this is more of a recent, people have been researching this a lot more recently, and what the effects of having adverse childhood events are, and how young you can see those effects. When I was in med school, I did research on how children that were born prematurely and the trauma, and whether or not this would show up later on as they developed. And so, there are tons of ways to process the different childhood experiences and what's happened to you growing up. And there's no one way to, fix it or anything like that. But it's important that it is addressed in order so that it doesn't turn into something long-term.
And then we see in the chat that this is reminding of the idea of co-regulation.
Yeah, that's a very good point. It's very similar. Okay.
All right. And I think Susie did such a beautiful job of talking about those theories of development. If questions come up later on, feel free to go back and bring up more questions. But now we'll sort of progress through the timeline towards the teenage years. What comes to mind, and I know we had one comment earlier about teenage distance, but what comes to mind when you think about teenagers' behavior?
Impulsive.
Yeah, impulsive. That's a great one. Feel free to add more comments in the chat while we continue. But the comment, and we can go to the next. Oh, irrational, yeah. Impulsive and irrational, I think, are great examples. Moodiness of what I think so many folks equate with sort of what we think of as the teenage years and the teenage experience, or what it's like living with teenagers. Just some brief review of some of the neuroscience behind brain development of adolescents. And again, I'm not an expert on this, but I think that an important sort of concept to consider is we have a lot of different parts of our brain, and different parts of our brain are responsible for different things. Two parts here that we'll talk about: the limbic system and then the prefrontal and frontal cortex. All the different parts of our brain develop at different rates throughout our life. And I think the current thought is, and our current science shows us that our brains are developing even beyond adolescence, really until like your mid-20s. And so the fact that different parts of our brain are developing at a different pace means that different times of our life might be more defined by what parts of the brain has become more developed, and how that impacts our interpretation of things around us and our reaction to them. So the limbic system is equated with more of emotion. Impulsivity is responsible for the reward pathway. So when we take a risk, if it's a positive or a negative reward, what do we learn from that? Whereas the frontal and prefrontal cortex is more responsible for our higher level decision making, goal directed behavior, planning for the future. So what we equate oftentimes with like adulthood, that adults are more likely to be thinking about like, how is this going to impact me down the road? Like teenagers are not thinking about how to plan for their retirement, whereas adults are. Some other comments in the chat: sporadic, stretching the truth. And I think that some of these words that people are thinking of are fit really well into, if we look at these two parts of the brain, the limbic system is developing at a faster rate than the prefrontal and frontal cortex, which eventually in our brain development ends up being more dominant for many, and I wouldn't say for everyone, but for many folks, that's the general progression. But in our adolescent years, the limbic system is a little bit more dominant. So with that in mind, I think we can all take a moment to just think about back to what it felt like to be a teenager. And I think a lot of those comments that I see in the chat and that I heard from you all can kind of reflect how and it makes sense that the limbic system is more dominant during those years. I think that impulsiveness is like a classic association for teenagers, and it makes a lot of sense when you think about that. I think one thing that I would be not doing my due diligence to this topic if I just didn't comment on like the mental health crisis that we're seeing in this country right now amongst adolescents. I think the CDC has even called it a mental health epidemic or crisis in our country in this post-pandemic time. The most recent statistic that I saw was that just over 60% of adolescents were reported having feelings of hopelessness or despair in this, having felt that experience in the past year on more often than not. And I will pull up, or if I can pull up more specific stats about the percentage of youth from different like demographic categories who have even had thoughts of harming themselves or suicide since the pandemic has started. I think there's been a lot of conversation in the media lately about how remote learning, being not in a school setting, how those things have impacted teenagers and adolescents. I mean, people of all ages, but how it particularly has had a really heavy toll on us adolescents. And I think when you think about, you know, the 2 slides ago about the, and some of the, when you think back about the way Susie was describing the conflict and the importance of what the role of a teenager is to do in terms of their development of that part of their identity before they move on to the next stage. But as they develop their identity, they're learning how to take risks, and they're learning, you know, what is a safe risk to take and what's not a safe risk to take. And when there's not time or opportunity for them to sort of grow in that way, it can have really harmful impact. Not to mention, I think the isolation that can come along with remote learning and not being able to have new and shared experiences amongst a peer group can also be really harmful. And yeah, exactly. In the chat, we're seeing that came across a statistic today that youth mental health rates are at the highest that they have been, which is true, and that is what that they're seeing in sort of national level surveys. And then I think COVID pandemic aside, social media is like this pretty, I mean, I guess it's, you know, new in our lifetime. I think Susie and I both, and probably most folks on the call, grew up in a time when social media, when we were in our early teenage years, that was not a thing that we had to navigate. And so it's kind of a new phenomena. And I think that there's, like many things, a real positive, like here on this Zoom call, we're able to connect I don't know where everyone is currently located, but like in theory, we could be all across the country, and certainly people might watch this recording on YouTube later. And there's a lot of power and benefit in being able to have access to social media and technology that way. But there can also be a lot of, I think, sort of negative. We hear about like online bullying and things like that that can really impact teens in a more negative way. So it's definitely complex. And then maybe before I open up for questions, I think one thing maybe a reframe that I want to think about when I think all of our initial thoughts about, the words that we associate with teenage years, impulsivity, irrational, moodiness, all of these things. While it makes sense when we think about sort of what part of our brain is dominating our actions in our adolescence, I think it's also important to think about, okay, well, what is the conflict, as Susie was saying in the Erickson model? What is the conflict that we're trying to resolve in those years? And really, it is forming identity. And in order to form identity, all of those, the impulsivity that we have at that time allows us to take risks and makes us really good learners when we're adolescents. And so those things that we often think of as like difficult, that makes teenage behavior difficult, really is also partly a strength, and it allows teens to learn, I think. It's just this period of time when they're not only learning so much about themselves and the world and how the world will react when teens do certain things, but learning so much about themselves and their own identity. So while it is, I think it's also a strength, and that's something that I try to really reframe for myself when I'm working with adolescents in a clinical setting. What questions or thoughts do people have?
Yeah, doctor, I wanted to when I mentioned about co-regulation earlier, I was thinking of like if there was a podcast I was listening to and the doctor was saying um that it's like the pandemic, for example, if kids have someone in their life that they can depend on and that they can see models co-regulation for them and kind of like is a strong support system and is there with them, then the impact of whatever they're going to feel from the pandemic is going to be a lot less than how they would feel if they were alone navigating that. And I just thought that was very interesting because it's like I mean, we see the impacts right now, but helping your kids and seeing them through a difficult time, it can have lasting impacts. Mhm.
I think that's such a good point, and I think we cannot overstate the power of having in an adolescent's life or at any point in time from childhood to adolescence, the power of having even just one really supportive adult in your life is, I think, really beneficial.
Absolutely. Yeah. I did have a follow-up question. Do you think also caregivers like understanding or maybe misunderstanding of behavior is contributing to like the mental health in kids, like not knowing how to talk to kids and not understanding where the behavior is coming from and not just seeing it necessarily as something bad, but as a signal to something a lot bigger within them. So
I think that's such a good question. And let me make sure I'm understanding it correctly, but thinking is sort of a misunderstanding on the caregiver's part about what's driving a child's or an adolescent's behavior or action, and sort of what that's coming from. Does that impact then how the kid or the two of them are able to work through that? And I think maybe yes and no. I think, and it looks like we've got some agreement in the chat that this is what I think a lot. Pujuma is saying, and I think, yeah, yes and no. I think that being able to understand where someone, and I would say this actually probably equates to people of all ages, but knowing where someone's coming from in their action, I think allows for communication. I think that conflict is often, I might be frozen.
yeah.
That conflict. Did I freeze?
Yes.
Okay, I don't know where I cut out, but
Conflict of, I heard the conflict of.
Yeah, that conflict is often something that we think about when we're talking about kids and parent, or adolescents and parents, and then how to work through and process that conflict. I don't think that I don't want parents to take away from that comment, though, that they have to know all the time where a behavior or an action is coming from. And I think oftentimes just having a foundation of trust and trying to communicate, even if they don't initially know where something is coming from, you can still work through that.
Absolutely. Yeah.
And then these are just two resources that I wanted to mention. One is from the American Academy of Pediatrics, and one is from the American Academy of Family Physicians. But they're two sort of like parent-facing resources that talk about healthy childhood, healthy adolescence. And I think I don't know that we can pull them up on this call, but I just encourage folks to Google later. AAP parenting website, this healthychildren.org, has just a ton of resources on all kinds of categories, from mental health to other physical health. Yeah, thank you, Susie. And then all kinds of back to school tips, and you can see they sort of categorize it through different age stages. This is a really robust website. And then the familydoctor.org is the other one that has similar types of topics. Say of the two, probably the AAP one is a little bit more robust, but they're both really excellent resources.
Sorry, trying to get back to the PowerPoint.
Yeah. And then we've got another question in the chat. Can we speak to the prefrontal cortex and behavior in both boys and girls?
That's a really good question. And I think a lot of studies more recently have kind of dispelled a lot of the earlier notions that brains develop much differently. I think I do think that what they have found is that boys' prefrontal cortexes tend to continue to stay in a developmental stage a little bit longer, about age 26, whereas girls mature sometimes between the age of 22 and 25. So it can just take a little bit longer for guys to get there, for boys to get there. But most of the development up until the age of the early 20s tends to be occurring around the same amount of time.
We've also got another question. What is the best way to help a child that has been through ACEs from both a parent perspective and just from someone outside the family looking in?
That is also a great question. And I think that there is no right answer for this. I don't think research or even, necessarily experience is gonna be able to say one answer is the right thing. I think in terms of dealing with adverse childhood events, acknowledgement that it has happened and finding some way for the child to process the event is one of the most important things. And whether that be through therapy or through discussion, at home or with a trusted individual, and then trying to help make sure that as they go through the rest of childhood, that you are able to catch if there's any developmental delays as a result of that, and get them help when you start to notice things at that time, trying to catch things early, basically.
I totally agree. I'd be curious if anyone else on the call has thoughts on that. And I totally agree with Susie. I don't think there's a one best way, and oftentimes it's going to be really kid dependent. What does that look like for them? But maybe folks on the call have thoughts too.
sorry, thoughts about, can you?
Oh yeah, about what is the best way to support a kid that's been through one or more ACE, adverse childhood experience.
I think like you just said, just talking it through, staying connected, having those conversations, and when they're ready. I know that kids sometimes don't want to talk about things, and they kind of talk about them when they're ready and in their own way, in their own time. So definitely keeping the conversation open and building that trust. Definitely.
Yeah.
Mhm.
I agree. I love that. And Taylor says in the chat, also agreeing each child is different. Definitely the acknowledgement part is big. It happened. We can't go back, but we can move forward.
Mhm. Yeah. What if parents don't acknowledge the ACEs? That's a tough one. And it also, there are types of adverse childhood events where, a parent might seem to be, on the side of the child as an ally, or it can be the other side where the parent ends up being part of the problem rather than also experiencing the problem. So, the whole family could be going through something that is affecting the child versus the parents maybe being part of the experience that the child is going through. And every experience is different. It's very hard to make global statements. I think as healthcare individuals, I think it's our job to every time that we have a touch point with patients, with individuals, and with kids, to do our best to make sure that we think that kids are safe in any environment that they're in, and just try to feel comfortable identifying red flags if a child is in a position where they're not safe, and then knowing what to do if you do see any red flags.
Yeah, I totally agree. And I think even just the part of that initial question of Taylor's that, as someone outside the family looking in, I think it's a good reminder, and Susie alluded to it too, that, it's parents, it's healthcare providers, it's teachers, but it's a whole community. And so there's all kinds of people who can be supportive to a kid who's going through something tough. Or conversely, who's there to celebrate something really good and boost confidence.
Yeah. And as doulas, you might be part of celebrating a wonderful part in a person's life where it is a celebration of them coming back from an adverse event, while at the same time, an initial moment of being very scared that they might perpetuate the same events or same behaviors that happened to them as a kid. It's a really amazing time in someone's life, and we're really privileged to be a part of such a vulnerable point in people's lives. And I think, just I see my role as a provider as being there to provide support in whatever way that we can, and being in a repository for information if somebody's not ready to deal with something at that moment. Can ACE affect one's DNA? That's a loaded question. So there is a lot of research that is going into looking at what they call genetic trauma, and being able to identify trauma, generations down the line, and looking at the genes of people who are descended from people who went through the Holocaust or other genocides, and being able to identify different markers in DNA. I think that the research is not very well substantiated, and that people don't necessarily know a lot about what the research means. So, yes, stress leaves markers on DNA, that we know, and some of that can make it to offspring, or your offspring. How that affects someone's life, how that affects someone's DNA. You know, the fact that you can measure it, does that mean it's important? That's the questions that I think people are trying to answer. Even if it's there in the DNA, does it cause a difference? Does it cause anything to be any different for a person? And that is research that I think people are still trying to figure out. These are really great questions. Interesting.
Absolutely. Does anyone have any more questions or comments for our doctors? I have just one last question, doctors. And just going back to like the prefrontal cortex and reasoning and teenage behavior, I came across something that says like the impulsivity has a lot to do with the fact that the prefrontal cortex is not well developed yet. And so when it's not well developed, then it goes to the amygdala, which is like the flight or fight response. And that's how we see all of this impulsive behavior, things like that in teenagers.
Yes, I wonder, is your question more confirming that that is sort of one of the theories around why teens react the way they do?
Yes, that's what I was wondering about. Yeah.
Yeah, no, I think that's accurate. And so, I mean, one of the roles that the prefrontal cortex can do is process like, okay, this was my experience. I have this emotional response. How do I process it in a logical way that's maybe not emotion driven? And if the prefrontal cortex isn't there to sort of help a adolescent navigate that, then it does go into more of like a fight or flight response driven by the amygdala. That tends to be maybe more of a more impulsive response.
Absolutely. And it's different both in boys and girls is different, the responses, because they have different brains.
Yes, it different in terms of how long it takes for the prefrontal cortex to fully develop, but they're all going through the same thing. And we're finding, as people are doing more and more research, that female and male brains look very similar. Just that male brains take a little bit longer to get the full development of the prefrontal cortex.
Got it. Gotcha. Thank you. Any other questions, guys? Awesome. As always. Yep, go ahead, doctor.
Oh, just that these have been really wonderful questions. We really appreciate everyone's participation.
Absolutely. Thank you for the presentation. Got so much out of it. Very informative. Thank you for taking our questions and comments as well. Yeah.
Thanks for having us. And if you guys have any follow-up questions, feel free to forward them to us. We're happy to, answer whatever we can.
Yep, I will forward any questions that come from the session.
Thanks so much.
If that's all, then I will dismiss our doctors and say that thank you everyone for being here. And doctors, I will be in touch about our next topic. And so thank you so much for coming through today.
Thanks for having us.
Yep, thank you everyone. Yep, have a good day.
Bye.
Bye.
Bye.